It is Tuesday, January 26th, 2021. Wat Kahnawà zo gwego, Joe Dalron Ujuts. Welcome to the Kahnawà COVID-19 Task Force update. And if you were listening to the radio a little earlier, you probably heard some of the big news. We do have some announcements coming up, and the chairman of the task force will be here, Lloyd Phillips, in just a little while to give you some details on that. But before we do that, we'd like to bring on Arnold Lazare, who of course is also a member of the task force, to bring you this update. Arnold.
Good evening, Kahnawake. As you may have heard, small positive changes to the measures are going to be made and implemented as we speak. I'm going to defer the good news to Lloyd. He deserves to give out some good news after all the hard work. But my purpose today is to review where we are and where we've come from. The community is currently in a positive place as we only have one active case. Of course, this would not be possible without the full support of the community. It's very safe to say that the community has been successful because of three vital statistics. We have had no hospitalizations, we have had no visits to the ICU, and we've had no deaths because of COVID. Everyone thought that the first wave was tough, and there was a drop in the numbers. People struggled to follow the directives, and unfortunately we saw a rise in the numbers again. It was predicted that the second wave could be worse if we weren't careful. It was also predicted that the holidays would be very dangerous. As a result of family gatherings, coupled with a false sense of security, the number of contagions increased significantly. The task force had to make some very difficult decisions, and a lot of people were not happy, but the three important numbers continued. No hospitalizations, no visits to the ICU, and no deaths. The stricter measures and the community's trust in the task force directives ensured that the three important statistics continued. And I will say it again, no hospitalizations, no ICU visits, and no deaths. The bottom line is that the numbers are finally being reduced, one active case, and this is directly attributed to the community's members doing what they need to. With all of the above, it's time to begin trusting the community is on a good path. We acknowledge that valuable lessons have been learned, and it is time to have the community show how it can persevere. It is with confidence in our people that the announced changes will be made this week. We trust that community members will keep up the good fight and continue to be in a safe way. We cannot ignore the fact that this virus is still very dangerous, and the possibility of it getting worse is always present. But by continuing to follow the measures that have allowed us to get to this place, we will continue to avoid the three important statistics: no hospitalizations, no visits to the ICU, and no deaths. We want Kahnawake to continue to shine. We want you to continue to be safe, and we would like you to keep up the measures. And more importantly, take care of one another. Now, Kahnawake.
Very well said, Arnold. And now, as we stated earlier, there was lots of news. And with the announcements, here is the chair of the COVID-19 task force, Lloyd Phillips. Lloyd.
Thank you very much, Joe. Thank you very much, Arnold, for your words and of encouragement and kind of setting the tone for the next part of Facebook Live update today. And as you may have heard already, we had some really good analysis and some discussion last week with the task force on direction moving forward. In terms of two of the main directives that are in place, Directive 54, which was household visitation, and 55, which resulted in the closure of many businesses in the community. So after we did a thorough assessment of where we are, and as we mentioned publicly several times, that once we had some solid information on numbers and also the trajectory of the cases in the community, and we had the number of people leaving isolation, we would look at where the next steps could lead us. And we also said that when measures are put into place, we want to put measures in place to serve a specific purpose, to have the desired effect, as well as we want to keep any restrictions in place as short as we possibly can. And when we felt we were ready to modify some of the measures, we were going to do so. So first, I want to speak about Directive 54, which was regarding no visitation, which had kicked in a month ago now, December 28th. After the holiday season, there was no visitation allowed within anybody's household, with the exception of a few caregivers and mental health visits and such. But because of the state that we are currently in the community, in a positive way, and as Arnold mentioned, and through the hard work of our community, we are now in a position where we could relieve that measure and allow for what we had during the holiday season, and have one household visitation within your home. Always keeping in mind that distance, hygiene, and masks are always required where appropriate. And this directive was set to expire on February 1st, but given, again, the situation that we are in, we have decided to relieve that measure effective Friday, January 29th. One household visit per family is going to be permitted. And it is recommended that you only have one visitation per week. That way you still have the ability to have a friend and or a family member come have a visitation with you, but we don't want to have where you have multiple contacts. So if there is a contagion or somebody who is positive, it still is contained as best as we possibly can. We wanted to make this change and as well because we understand the stress and the anxiety it does have on individuals who have been home alone or have been within their household only with them for the past month, and we do understand that people want to see others in a more meaningful way. So in order to reduce some of the anxiety and some of the stress on the community, we decided that this was the appropriate time to change household. And as you can see up on the screen now, there are examples, and these are some of the ones that we had put up during the holiday season and other times. This will be readily available as well, where it gives you some examples and a snapshot of how to visit safely within your household, to make sure that people are properly distanced, how to set up your table as such if someone's going to be having dinner with you or just visiting. And it's important to keep this in mind and be mindful when you're planning your get-together with a friend or a family or another household, I should say, because it's very easy in the beginning of the get-together. Everything is spaced out properly and everybody's abiding by the measures, but as the evening goes on, people tend to congregate a little more. So again, this is just a reminder that we have to be very mindful of that. Keeping in mind that also these private home visits or our household gatherings are not something that we look for to say any type of party. That's not something that is permissible, and it shouldn't be used as such. It's more about visitation. Certainly parties, and we know certainly Super Bowl is coming up in a couple of weeks' time, so that's something we're certainly highly discouraging, and no party should be taking place. Or no, this should not be used as an occasion for multiple household gatherings or even individual family members from multiple different households. So it's still really, one household interacting with another household to a form of visitation. And it's also, it's not recommended for somebody who is to have a private home visit if somebody is at risk, meaning somebody who's over 70 years old, somebody who is immunosuppressed, or somebody who is living with somebody who's a vulnerable person, or somebody who takes care of somebody who is at risk. It's not recommended, but we understand, again, the hardships that people are with in terms of being somewhat isolated and not having to have any meaningful contact with people. So if somebody is in a vulnerable population, and if you do choose as a family, and it is a personal choice, we certainly understand the circumstances, and certainly an extra level of vigilance should be done, and you have to understand the risk and make that decision again as a family, as a household. The same goes across the board. If you as a household do not feel comfortable having anybody else enter your home, by all means, that's your choice, and you can maintain the way it is now. But we're again, as a community, as a collective, we're feeling that these modifications, we are in a better place to do that. And certainly, if you have any signs or symptoms whatsoever of COVID-19, or even if you think you're catching a cold or any type of other flu, do not visit. Stay home and isolate yourself. Because a lot of the symptoms that we're seeing are very mild at this point in time, and they may be mild for many people, but they could be very serious for others. So if any type of signs or symptoms of a cold or COVID, stay home, isolate, and then you could always reach out to the Academy Memorial Hospital Center's public health line and call them, and they'll advise you on the next steps on whether you need to be tested or not. So again, it's a positive step. We understand that, again, it's the responsibility of individuals to take the information, implement it the best way it is for your home, to be safe, but also to take care of one another, and again, have a little more meaningful interaction with friends and or family members. The next directive I want to speak to is Directive 55. In conjunction with 54, as I just spoke about, which were out throughout the month of January, they did have the desired effect. We were here just a few weeks ago talking about a dire situation in the community with the numbers and the trajectory of cases. We were not on a good path. The past 6 weeks have been long and hard, and as Arnold mentioned, a lot of tough decisions had to be made in order to try to break that trend and break that curb. And closures of retail and manufacturing was a part of that puzzle to get people to stop moving as much as possible to break that trend. Because often, as we said, the virus only moves if we move. And we felt a combination of 54 and 55 with the closure of business, it minimized much more people moving, and it resulted in a positive result. And part of the isn't directly in 55, but also at the same time, all the community organizations were also reducing the risk of reducing the number of staff in their buildings, and allowing people to work from home much more, to ensuring that within those organizations, the work can still continue to a large extent, but people were working more remotely and working more safely. So it was a combination effort on that to ensure that we are being as safe as we possibly can. So As we said publicly already, but now we're here to confirm the fact that Directive 55, which is set to expire February 1st, will not be renewed. We will be allowed to run its course, and the retail establishments who were impacted by 55, can be resume operations effective February 1st. We also understand that there needs to be some ramp up of manufacturing to be able to support the opening of retail. So again, because of the good place that we're in, manufacturing could resume as of Wednesday the 27th to get their processes moving, so that come the first, everybody's ready to operate. So again, positive news in that sense. But also, we just want to relay some information, and I'm sure people understand and recognize and are aware that Quebec has imposed a curfew on their citizens. That curfew has never been implemented within the community of our community. So with that in mind, we certainly don't want to take the steps to encourage Quebecers coming out of their homes after their curfew, being subject to possible fines by outside forces and such. So in I guess support of that, and in collaboration to ensure that the measures are followed by Quebecers, we are going to be requiring that the stores who are currently open to be closed at 7:30 p.m. That way people have the opportunity to come here, carry on their retail business, but have time to get home, in their homes in safety, and not disobey or go against Quebec directives. So I think we have to do our part as a community, because the Quebec directive is there for a reason as well. It's there to stop movement of Quebec citizens, it's there to minimize contacts, and it's there to help protect the healthcare system. Because we're not out of the woods yet, by no means. We're feeling confident where we are now to be able to take some small steps in this direction, but in the bigger picture, we still have a overall responsibility. So these things are moving forward, and I believe it's in a positive manner. We're able to take these steps, but as we said before, and I'll say it again, we got to be vigilant, we got to be careful. I hope the day doesn't come where we have to revisit the fact of reclosing certain establishments, or reclosing retail, or reclosing manufacturing. I'm hoping we can maintain the fact of one household visitation for the time being, and talk about further measures being reduced as we move forward. That's where the task force wants to go, but everything is always subject to the situation we're in. As we've seen 3 weeks ago, things were very dire, and things have improved substantially as we speak today. But where are things in 2-3 weeks down the road? We always got to keep watching that. So as things progress, there may, and I'll be quite honest and quite frank with you, there may be the possibility of revisiting these types of measures and re-implementing them. But that's not the path we want to follow. We want to stay on a path of the trajectory of letting more people have more freedoms, and having people have more decisions to be made for their home and for their individual selves. But we are here today, and I'm glad to be able to have this announcement for the community. That will take us, relieve some stress, a little bit of anxiety, and let people get back to the workforce as quickly as possible. So with that, I thank you very much. Yawagoa, Onigawahi.
And thank you very much, Lloyd. And again, some good news. By the way, if you want some detail on the new directives, the information is available. Go to www.Kahnawake911.com, and it's all there, because there are some details that you need to see just to make sure that all the directives are being followed properly. So with that, like we said, a lot of good news today. We are on a good path, but we have to stay careful, and let's be safe out there, Kahnawake. So on behalf of everybody here at the task force, we'd like to say, Yawagoa, Tano, Onigiwahi.